Are you experiencing unexplained fatigue or weakness lately? If yes, then it could be one of the subtle signs of kidney stones. Kidney stones are a common and painful condition that affects millions of people worldwide. While some symptoms of kidney stones are obvious, others can be quite subtle and easily overlooked. In today's video, we will be discussing the 8 subtle signs of kidney stones that you shouldn't ignore. So if you want to learn more about these signs and how to prevent kidney stones, stay tuned and keep watching. Number 1. Severe pain. Kidney stone pain, also known as renal colic, is an extremely severe type of pain that some people describe as comparable to childbirth or being stabbed with a knife. And did you know that this pain accounts for an estimated 500,000 emergency room visits annually? The pain usually starts when a stone enters the narrow ureter, causing a blockage and fluid pressure to build up in the kidney. This pressure activates nerve fibers that transmit pain signals to the brain. Kidney stone pain often begins suddenly and changes its location and intensity as the stone moves. The pain comes and goes in waves, which is made worse by the ureter contracting as it tries to push the stone out. The pain is typically felt in the side and back, below the ribs, and may radiate to the belly and groin area as the stone moves through the urinary tract. The size of the stone does not necessarily relate to the severity of the pain, as even a small stone can be extremely painful as it moves or causes a blockage. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Urgency to use the washroom. If the kidney stone has shifted into the lower urinary tract, you may experience a sudden and urgent need to use the bathroom more frequently than usual. This includes feeling the need to urinate frequently throughout the day, and even having to run to the bathroom urgently. It's important to note that this urgency is sometimes mistaken for a symptom of a urinary tract infection or one of the major symptoms of type 2 diabetes. Regardless of what's causing frequent urination, if that's happening to you, do not take it lightly and get yourself checked as soon as possible. Number 3. Blood in urine. Hematuria, or blood in the urine, is a frequently reported symptom by individuals with kidney stones. When that happens, the urine may appear red, pink, or brown in color. In some cases, the blood cells in urine are too small to be visible without a microscope, which is referred to as microscopic hematuria. If you suspect you have blood in your urine, your health expert can perform a simple urine test to confirm the presence of blood and suggest the way forward. Number 4. Cloudy or smelly urine. Cloudy or smelly urine is a potential indicator of an infection in the urinary tract or kidneys. Healthy urine is typically clear and odorless. Puria or pus in the urine can cause cloudiness, while bacteria associated with UTIs can cause foul odors. Concentrated urine may also produce an unusual smell. According to a 2021 study, roughly 16% of individuals with acute kidney stones also had a UTI. If a UTI occurs in conjunction with a kidney stone, medical attention is required immediately, regardless of the presence of a fever. Number 5. Low urine volume. When a large kidney stone becomes lodged in the ureter, it can potentially obstruct urine flow, leading to a range of symptoms. One common sign of this blockage is the frequent need to urinate, accompanied by a limited release of urine each time. In some cases, the urine flow may come to a complete halt, which requires immediate medical attention and is considered a medical emergency. Number 6. Nausea. Besides other symptoms, nausea and vomiting are also among the common symptoms of kidney stones that you shouldn't ignore. This can happen as the shared nerve connections between the kidneys and the GI tract can trigger an upset stomach. In some cases, nausea and vomiting can be a response to intense pain caused by kidney stones. Severe pain in any part of the body, including the kidneys, can cause your stress hormones to rise. These stress hormones can interfere with the normal functioning of gut-brain connection, leading to the symptoms of stomach upset like nausea and vomiting. Number 7. Fever and chills. When an infection is present in the urinary tract or kidneys, due to kidney stones or any other reason, this can cause symptoms of fever and chills. This can mainly be due to the body's natural immune response to the infection. During a bacterial infection, our immune system sends white blood cells to fight the infection. This immune response can lead to the release of chemicals called pyrogens, which can cause a fever. Additionally, shivering or chills can occur in response to the body's attempt to normalize the temperature. Kidney stones can cause this complication, but sometimes it may indicate other serious health conditions, so it's crucial to seek immediate medical attention if you experience fever and pain. Number 8. Fatigue or weakness. Fatigue or weakness is one of the subtle signs of kidney stones that should not be ignored. These symptoms are usually caused by dehydration, which can occur when the body loses more fluids than it takes in. In cases of kidney stones, dehydration can happen due to decreased urine output or excessive sweating. When the body is dehydrated, it can lead to a decrease in blood pressure, leading to the symptoms of fatigue and weakness. Now let's take a look at some of the effective home remedies to help prevent the formation of kidney stones. Number 1. Drink plenty of water. Drinking plenty of water is important for our overall health, including preventing the formation of kidney stones. When you drink enough water, it helps to dilute the urine and flush out any substances that can form stones. It can also help prevent the crystals from forming and sticking together, which otherwise could lead to the formation of new stones. Number 2. Increase your intake of citrus fruits. Citrus fruits, such as lemons and oranges, contain citrate, which can help prevent the formation of kidney stones. Citrate is a natural inhibitor of stone formation, as it binds with calcium in the urine, preventing it from forming crystals that can form kidney stones. In addition to lemons and oranges, grapefruits and limes also contain citrate. It's important to note, however, that while consuming citrus fruits can be helpful for kidney stone prevention, consuming large amounts of citrus can also increase the risk of kidney stones in some people. This is because citrus fruits contain high levels of oxalate, which can contribute to the formation of calcium oxalate stones. But as long as you are consuming them in moderation, experts say there's nothing to worry about. Number 3. Eat foods rich in dietary fiber. Foods rich in dietary fiber, such as whole grains, fruits, and vegetables, help prevent the formation of calcium oxalate stones. This is mainly because fiber has a tendency to bind with calcium in the intestines, which can prevent excess calcium to enter the bloodstream. Plus, it also facilitates the removal of excess calcium by simply pooping it out. Number 4. Limit your intake of salt and animal protein, as they can increase the risk of kidney stones. Number 5. Try drinking herbal teas. Teas such as dandelion root or nettle leaf can act as natural diuretics and help to increase urine flow. Number 6. Apply a heating pad or hot compress. Applying it to the affected area can help you get relief against pain and discomfort. It's also important to note that these natural home remedies are not the way to treat kidney stones. You should always consult a health specialist if you notice any of these signs of kidney stones. Thank you for watching and subscribing to the channel. See you in the next video.